Okay, now she's on her back. Here's the medial knee attachments from this position.
Oh, it's crunchy.
There's the deck of cards right there, huh?
Yep.
Right over what most people think is skin and bone. Medial knee attachments. Eh?
But it's just all these little. They're just little.
I call that a deck. I call that a deck of cards. You feel the.
Oh yeah.
You feel the little. That's right. That's what I call it. I call it playing the body like a one-time deck of cards. The stroke is one time. Angles and locations, we get that deck of cards feeling. So let's talk about, teaching people to guide. So, like if I'm stroking like this with my leaf rake, I'm starting a little late now, right?
Yeah, but that's plenty.
But location-wise, I'm starting late. So you might want to say, start your stroke earlier.
Oh.
That means start.
Yeah, there's definitely more.
Start your stroke earlier. Or if I'm over here, you might say, make the stroke longer. And what we're looking for is this, right? That's what we're looking for. Is the medial knee attachments. That's the fundamental. And it's up to, I've been doing this for 30 years. I know what I'm looking for. But most people out there, what I get a lot of is, people, they got the book. Do I know anybody in Seattle that does this work? No, I don't know anybody in Seattle that does this work. But the thing is that we teach you to guide, And so I was emailing someone yesterday, that I don't know anybody where she's at, but the whole thing is we really teach you to guide. So if you're going to say, start your stroke earlier, make a longer stroke, and you're going to guide them. Because you can tell when we have this.
Yeah, you can feel the difference.
It's distinct. What we're looking, the fundamentals they're distinct. And these are the medial knee attachments. These are gateways to opening up the upper leg here. And what we can do then is we can move up north of that, and we can follow this all the way. We can follow it all the way up the leg. We can continue on, right? Bam. And so sometimes you're going to feel like you have a deck of cards rolling a piece of flesh. Sometimes you're going to feel like you have cleaning out a seam or a crevice.
Ow.
But you and I can always tell when it's distinct, right?
Yeah. Yeah.
Like that, right there.
Yep.
That's distinct.
It feels like a line you're going over.
That's right. So the fibers of the leg, they all go straight up and down. And it's like lanes of a freeway. There's always a deck of cards next to the one you're working on. Right?
Yeah.
And so this is what I call a long stroke, using oil. And because legs are, there's a lot of ground to cover, so this is definitely a place I definitely use oil to scan. And then when we find a hot line, we can isolate.
Oh, yeah, yeah.
We can isolate on one deck of cards. So this is an isolation stroke where I'm isolating on one deck of cards. This is a long stroke. And again, there's a time for both, and we're just going to give you options. So there's a time the whole thing feels involved, and those big, long, sloppy strokes are great at opening up the whole thing. And then there's a time you're going to want, nope, there's too much waste in there, just isolate on that one little deck of cards that I need.
Yeah. Yeah, because it took a few long strokes for that to even wake up enough to feel like it was something.
That's right. That's right. Yeah, we give, we don't stroke and say, how does that, sometimes you work it a minute, because sometimes it just takes a few strokes to wake it up.
Yeah.
That's right.
And then that still ends up being nothing sometimes.
That's right. That's right. That's right. So there you go. So that's very simple, and all we're going to do is the fibers run straight up and down. We're just going to come one way or the other. We're going to put them in different positions to cover it in sections. That's all we're going to do. So to the outside of the leg, right here. So here's my in on the. Here, let me do a long stroke, and just so right. Not every stroke I do is good. Right there. Feel that deck of cards?
Yeah, but it doesn't, I feel it kind of grinding, but it
Doesn't feel like anything.
feel like anything.
There you go. This is the lateral knee attachments. And I have a deck of cards, but it doesn't mean anything to you, right? That's what you're saying?
It's not that.
Doesn't feel relevant.
Involved, yeah.
Right? But there you go. So lateral knee attachments, not involved. And we can scan up. We can scan up the leg. That's all we do is scan and ask your patient what it means to them, because really, I cannot tell. So there's the medial and lateral knee attachments. We bent the knee, did the quads from different positions to get one half this way, one half the other way, and we did the crisscross behind the leg. And so that's all we do then, as we scan those ends. And of course, if your body says follow it someplace, you follow it. And this is how we fix knee problems. We just scan these basic patterns. And so, for example, I never had a knee pain in my life until one day I was over playing volleyball. Didn't notice anything at the time, but the next day when I got out of bed, I felt like I've got bone-on-bone arthritis. Mm-hmm. Never had it in my life. Mm-hmm. Now, fortunately, I know better than to freak, and I know what to do. And when they did that crisscross stroke behind the knee, it went way up into my hamstring, way down the calf, more than I was ever aware until they stroked it. Mm-hmm. And those were the hot lines. Mm-hmm. And so we focused on those. And then those lines calmed down. Then it was the medial and lateral knee attachments was the hot line. And then we worked those. And as those calmed down, then it was the quads, your thigh muscles in here. And so my case, it was the whole thing. I mean, we worked hot line. Hot line calms down, next hot line, right? And now I had another guy who was a baseball catcher, who's like, 30 years old. And you're thinking the whole thing, right? He's got knee pain. He's been a baseball catcher. You think it's the whole. So with the baseball catcher, in my logical brain says, I bet that whole thing's involved. Mm-hmm. But on him, we scan. There's only one hot line, the medial knee attachments, and as soon as we rubbed it out, he's fixed.
That's amazing.
So this is why, again, stop analyzing. Forget what you think you feel.
Yeah.
All we do is scan the patterns, and they're gonna talk to you.
It's gonna surprise you every time.
That's right. Exactly right.